Today let's discuss about the recovery period in children having virtual autism or kids who are at risk of developing into autism. This is Dr. Jyotsna Tanigundala from Daffodils Child Development Center, Hyderabad. So generally, when we call a child as having at risk of development or under the virtual autism, I hope by now you all are clear that those kids in whom got exposed to high level of screens, that's like around 7 to 8 hours of average screen time per day, and those children who are left out without having more interactions either from the parents or from the grandparents or caregivers, anyone at the home. That means the children who are not stimulated appropriately using the language, but instead they got used to seeing the screens for a prolonged duration of time. And in such children, in case if you see any deviations in your normal development, like not responding to the name call, not maintaining eye contact, or not using words as per their age, or few children might even develop toe walking or the hand flappings. Such children comes under or can be grouped under children with a high risk or the children with virtual autism. Now let's see if at all as adults, if we could work on and control all such factors in the environment, like not giving screens or reducing the screen times and increasing the language stimulation at home. How do we increase? Definitely it's with the play. And what would be the best way to play with the children? To make use of the everyday routine activities like your bath time, your feeding time, or your just a bubble play with the children. Everyday routines, if the parents can make it more interactive and more enjoyable to the children, that's when kids would start enjoying and participating in the activity. At the same time as we'll be providing running commentary while playing with the children, definitely they'll get a lot of language stimulation. And of course, a professional help in terms of therapies or in terms of medications, all this together at the early stages of developing into the autism is definitely going to help children to recover in a much better manner. And generally with my clinical experience, what I have seen is if the children who meets the criteria of this virtual autism or just at the risk of developing into autism, these children are recovering within 6 to 8 months of duration, when all the set criteria or the stimulation is met in an appropriate manner. So parents, please be consistent in your play, please be consistent in your interaction and try very well for at least 6 to 8 months, and I'm sure in the young stages you will start seeing lot of good improvements in the children. And few kids are very smart, especially during that borderline phases where they are tilting into the autism. In those children we are seeing a drastic changes. Within 6 months they are becoming just like any other normally developing child or a typically developing kid. So the average recovery time for the children who are at risk or with a virtual autism, you can count it as 6 to 8 months, provided therapies, adequate parental stimulation with proper parental training. Thank you so much. If you have any further queries, please put it on our comment box. See you.